All right, hello and welcome back. I'm your host of the Doc Buddy Journal, Erik, and today we're joined once again by Bill Prentice. Bill, of course, is the president of the Ambulatory Surgery Center Association. You might know it better as ASCA. Bill, thanks so much for coming back.
Erik, pleased to be here. Thanks.
Well, the last time we spoke was in 2023 in the lead up to that ASCA annual conference. I know a lot has changed for ASCA in the time since. I'm hoping you can give us a rundown of some of the key wins or some of the key initiatives that ASCA concluded in 2024.
Sure. When I think back on last year, I think one of the biggest changes we made at ASCA was kind of an internal one, which was the decision that the ASCA board made to make all of our virtual education free. It's something that was, afforded to our members at a reduced cost, but we decided that the education and training that ASCA provides was so important that all of those virtual sessions, so all of our webinars and virtual seminars starting this year are now free to members, which I think is an extraordinary benefit and something that we've gotten really excellent feedback from. So when I think back on last year, I think that's certainly a sentinel event and something that we're very proud of. We've already seen dramatically improved attendance at our sessions as a result of that. And obviously, I think that's going to carry forward to our annual conference, where of course there still is a registration fee, but we think that there's going to be a lot of interest in that conference. From a legislative and regulatory standpoint, last year was kind of quiet in a lot of ways. I think we were a bit disappointed that the Medicare program didn't expand the number of procedures, the types of procedures that surgery centers can perform on Medicare beneficiaries. We had some high hopes to get some additional procedures that didn't come to fruition. However, I think we're pretty bullish about this year. And so when we get to talking about 2025, I think I can hit on some things that we're really looking forward to.
Yeah, that's a great segue. I'd love to hear both what ASCA has on the front burner for the year for 2025, and sort of tied into that is the CMS 2025 final payment schedule that was released in November or thereabouts. I'm sure the two are interrelated to an extent, but would love your thoughts on those.
Yeah, well, to that point, we're already at work trying to educate CMS on the things that we would like to see them do this year. Obviously, we're with an entirely new administration, a big change, obviously, from last year, from Mr. Biden to now Mr. Trump. We obviously have experience because of the prior Trump administration to kind of have a sense. Of course, there'll be different people in those leadership roles, but kind of just a sense of what might resonate with them based upon that prior administration. So we're doing something we haven't done before. Is we're actually going to send, basically our wish list of things that we'd like to see them do in the next week or so. So well ahead of when our proposed rule would come out, which is generally around the 4th of July. So rather than wait until that proposal comes out and respond to it, we're trying to actually, seed them with some ideas of things that, we think are high priorities for the ASC community and which would really benefit Medicare patients. And so when I think of those things, first and foremost, obviously, is getting additional procedures onto our payable list. So whether it's cardiac procedures, spine procedures, we know that there's a lot of things that surgery centers are performing on commercial patients that Medicare beneficiaries would also benefit from. So we're really hoping to get those procedures added this year. And again, based upon our prior experience, we think that this administration will be more open to adding some of, if not all of those procedures. The other thing I think is that's going to be a big focus for us is over the past few years, our quality reporting program has started to get larded with measures that we don't think really benefit surgery centers or patients. We don't think they're really measures of quality and patient safety. And I think, the time has come to try and kind of pare those back and really, just add to our program measures that have been, for one, tested in our setting. And that's another problem that we've had is recently measures have been added that may have been tested in hospitals or somewhere else, but have not been tested and proven to be, of importance in the surgery center setting. And we'd like to see that done away with and really get back to adding into our program measures that would really benefit patients by showing that we're a safe, high quality site of service. So those are two of our priorities. And then thirdly, and this applies to obviously every Medicare provider, is we'd like to see better reimbursement. We obviously think that the delta between what we're being reimbursed versus other settings for what we do needs to change. I think we provide great value to the Medicare system, and um, the more Medicare can do to incentivize surgery centers to take more Medicare business, it saves the system billions and billions of dollars. So if they can try and incentivize us by just paying us a bit better for the things that we do and we do very well, we think the Medicare program, the taxpayer, and the Medicare beneficiary are all going to benefit.
You took the words out of my mouth there, and certainly wouldn't want you to tip your hand with the communications going out to Washington. But obviously, efficiency is very much in the news right now with some of the budgetary items being double checked. It seems that the ASC is ripe for the same type of treatment, but maybe going the other way, that you have this highly efficient place of service, better for patients, better for cost, better for the system overall. I would imagine that plays a role in some of your messaging.
It absolutely does. I mean, we know that there is a real big appetite to create budget savings, particularly because I think there's an interest in obviously doing some tax cuts this year from the administration. And I think we're going to be able to show the administration that there are some very simple things they can do that are going to drive volume to the surgery center setting, save that program billions of dollars, and free those up for obviously other purposes. And it's not going to be anything dramatic. It's not going to be a serious shift in policy to create those savings. So it's some very simple things that we've been asking for years, and we're hoping that finally we're going to be dealing with an administration that is interested and has an appetite for doing those things.
Well, that's wonderful. I know that'll be an education for many in Washington. The last time we spoke, the ASC was sort of the best kept secret in healthcare. If you're not in the circle of trust, so to speak, then maybe you wouldn't be so familiar with the surgery center.
Right.
And I know advocacy for that place of service was a key initiative back in 2023 for you. I'd imagine that's continuing.
It is every year, and really important element to that is that we need everybody in the ASC community, whether it's our the ASCs themselves, vendors, everyone who benefits from the fact that we're a great site of service, to be engaged in that advocacy. And so we have lots of ways for people to do that. Hosting site visits in their surgery center with their lawmakers, whether federal or state. Coming to Washington for a fly-in, which is going to be held this coming fall. But we really need to all work together to educate our lawmakers and policymakers about the value that the surgery center model brings to our healthcare system, because obviously there's a lot of competing interest out there. But if we can get their focus, I think we can show them that we are a solution to the rising cost of healthcare. And to the problems that people have with availability of healthcare.
That's right. So that's a critical piece of education going out to Washington. We opened the show by talking about all of the now free resources available from ASCA in terms of education, but still the epicenter for surgery center education really is the ASCA annual conference. And this year it's in Denver, Colorado, April 30th through May 5th. Of course, we'll have a link to more information to that event in the show notes. What are some reasons folks would be excited about heading out west for this year's ASCA, Bill?
Well, sure. Well, for the first thing, as you mentioned, west, this will be the furthest west we've been in my tenure at ASCA. So we're talking about 15 years. So I think, we're going to be at a new location, the brand new Gaylord Rockies in Aurora, Colorado, right outside of Denver. Very conveniently located near the Denver airport. It's only about a 10, 15-minute commute from the airport to the Gaylord. It's brand spanking new. It's unlike some of the older Gaylords where you feel like you're walking through like a forest or a jungle when you get through the front desk. You don't have that at this property. It's really convenient. Lots of great food options. We have a great conference scheduled. We have great sessions. One of the things I think we're really excited about is we have a day and a half of infection prevention education, which we know is so critically important for our members and for patients. So we're really excited about that. Another thing that we're really highlighting is, we've got a lot of feedback in recent years about people really enjoying panel discussions rather than just having a lecturer. So we have seeded this meeting with a lot of panel discussions that are going to allow for a lot of conversation. And I think it could be really effective in terms of helping people to get the education they need. As always, we're going to have a keynote session. We've got Melissa Stockwell, who's actually a Paralympian from Colorado herself. I believe she was the first female to lose a limb as a soldier in the Iraq War. Has an amazing story to tell, obviously, about that and about her successful athletic career. She's competed in the Paralympics as a swimmer and a triathlete. She's still a really engaged and motivated triathlete. I think she's going to be really an interesting speaker and very, very motivational. And then, of course, we also, kind of cap our meeting with an amazing social event on Friday night that's usually a lot of fun, a lot of singing, dancing, a lot of camaraderie, a lot of opportunity for people to meet colleagues from around the country. So we're really excited about the meeting, and I'm very excited to report that I think this meeting is really resonating with our members. Our registrations are way ahead of pace from last year. And as I said, being at the furthest west we've been, I'm really hoping that folks from the West Coast who may be a little less eager to come to our conferences when they're on the east side of the country will be motivated to come and experience ASCA 2025 because it's going to be an amazing event.
Flying into Denver, that's about as easy as it gets from anywhere in the country. The Gaylord, gorgeous new facility, and it is just a very short ride from the airport.
Yeah.
Going to be an impactful event once again. Bill, I want to thank you for your time. Hopefully, we didn't gloss over anything. Know you're a busy guy, so thank you so much for joining the Doc Buddy Journal.
Well, Erik, we could talk all day about all the things that we're up to at ASCA, but I don't think you want to do that. I very much appreciate this opportunity to spend a few minutes with you and talk about some of the good things that we're doing. And hopefully I'll see you and all the listeners in Denver at ASCA 2025.
You better believe it. We'll be there. We'll get a link to the event in the show notes. And with that, we'll talk to you again next time.
All right, thanks.
Thank you, Bill.